This is one place where nobody wants to end up. The StarBase COVID Treatment Unit. The fight against this disease is pure heroism, not only for the patients, but also the medical team who are doing their best to save lives.
My name is Dr. Hisu, Dr. Winninho Hisu. As of last year, March, when we had our first case of COVID in Liberia, I started work at the HOTT military hospital, and over time built a team of doctors, nurses, and hygienists to manage COVID-19 patients. So at the time, I served as the clinical coordinator, and up to December last year, we were at HOTT military, after which we transferred here to StarBase. So right now we are at the StarBase facility, where it has been designated as a national COVID-19 treatment and isolation center. At this center now, the clinical coordinator is Dr. Richard Doe. We've seen this wave of COVID-19 in the last month. Has been really, really bad. It's way worse than what we saw last year. And this is why we decided to invite the independent media group here, you guys, to come and see for yourself what is happening at the treatment unit. We want the Liberian people to be able to see what is happening at the treatment unit, to know how severe the situation is with COVID-19 in Liberia at the moment. This is the StarBase COVID-19 Isolation and Treatment Unit across the bridge in Monrovia. This is the main entranceway where vehicles come in, ambulances, visitors can come and park outside. We don't allow them into the compound actually. So this is what the building is, and this is the pathway through which ambulance go to where and drop off people who are suspected of COVID-19, suspected cases, come to this side. And right in the back there, which I'll show you, is where we move confirmed patients into the unit, okay? So if somebody was having difficulty breathing, having issues, with symptoms that are consistent with COVID-19, they could get brought here by ambulance, or their relatives could bring them, and we take them through here and we admit them on the wards. We swab them and we do their test. This side of the building is the staff quarters, that entire portion where we have the nursing station, the doctor's office, the administrative office, and this side of the building is the main hospital where we have patients, all right? Like we said, it was really important that we have an independent media group come and just do a walkthrough so that we understand what's really happening and people are not, in disbelief that we don't have cases of COVID. This is Dr. Richard Doe. So Dr. Richard Doe is now the clinical coordinator for this facility. So he runs the facility, and we're here, we work with him and we support him through the process.
So this is where the staff are usually located.
Hello.
Excuse me. This is our nursing station. And here are a few of our nurses.
So these guys are the real backbones behind the COVID-19 response, all right? They work crazy hours, 24-hour shifts, sometimes 38-hour shift is needed, and this is their workspace usually. So they sit here, we have the patient charts, and in the back there is their little call room where they have a bed that they could lay and sleep at night when they're on call, when they're on shift. So this is where they prepare most of the medications from the pharmacy. They bring it in here, they prepare them, they make sure they chart them properly, and then they go to where the donning station is and then go in to see patients. So you can see she's just from inside the unit, and you can see how she's sweating. So she's been wearing PPE for the last, how long you been in the unit for?
3 hours.
3 hours, exactly, yeah. So she's just spent 3 hours inside seeing patients, and she just came back. So currently here at the StarBase unit, as of today, we have 43 patients admitted here at the hospital. Now out of these 43, 27 of them have what we call severe disease. So which means currently inside of this unit that we're sitting in, when we go to where we have the patients, 27 people today are on high flow oxygen. Those are the people that meet the criteria to say you have severe COVID-19 pneumonia. At no given time last year, during the heat of the outbreak last year was between June, July, and August, all right? At no given time did we have 27 people that were severe to critical. This is the reason why we think it's important that we get the message out there to people that whatever it is that we're dealing with right now seems to be more severe than what it was last year. In the back, there's just more spaces where we have the laboratory that we are currently equipping, all right, to be able to run different laboratory samples like kidney function, liver function, and other things like that. Now, this is the pathway now to actually go into the unit, okay? So we're gonna have you guys dress up in PPE as well and do a walk through the unit with us, all right? Infection prevention control is number one. The mantra is we say, keep safe and keep serving, all right? So we want all healthcare workers to remain safe. So we have very strict protocols on how they proceed when they enter into these places. So this is where we have the donning station. It means putting on your personal protective equipment. It's not a lot, but we have the protocol here on how to get dressed. So we first wash your hands, dry your hands, wear your goggles, wear your gown. Now this is enhanced PPE, all right? This is high level PPE when you go into the ICU. Okay, when you're seeing patients who are on a CPAP machine, when you're doing what we call aerosolizing generating procedures, okay?
We suited up, and Dr. Richard Doe, Dr. Romello Jesus, Dr. Augustin Carly and their team took us on a walkthrough inside the StarBase COVID unit.
This is Bati. He's our supervisor O2 therapist. He's the man behind everything. Like the demand for oxygen here is so high, and we rely on them heavily to make sure that we have constant supply of oxygen to all our patients, all right? So Dr. Doe and Dr. Colley are already in the unit doing their rounds and seeing patients, so we'll meet up with them when we go. Now, this is the entrance way. We call this the red zone because once you cross this door and go on that side, you cannot come back on this side, all right? That's where we have confirmed patients. That's where we have the ICU. You can see that this is room 1. That's a new patient that was just brought in, and Dr. Colley is now helping to resuscitate the patient, all right? So you can see she's on high flow oxygen and non-rebreather mask, all right? So this is one patient that was just brought in now, like 15-20 minutes ago. So Dr. Colley is the guy there, Dr. Doe, and that's one of our nurses. The other patient there, she's been here for us for like 5-6 days now. She came in very critical condition. These blue things you see are full oxygen tanks, all right? We call them the H tanks. So these people are requiring high flow oxygen, up to 15 liters per minute. All right, so that lady there now, she's starting to improve little by little. One of our biggest challenges is the fact that people simply do not believe that COVID-19 is real or that it's in Liberia, okay? So, sometimes, as people who are here seeing these patients, you get to see firsthand the kind of, suffering and dis-ease that they go through, okay? And then when you turn on the TV or you go on social media and then you see the general population saying, oh no, it's not real, oh, it's fake, these people are lying about it. It's a huge challenge for us because that disbelief that's in the community, it baffles me how our Liberian population can see what's happening in India, can see what happens in other countries and believe it. But when it's happening here, they tend to, not believe it. Of course, there's a trust issue with the system, with the healthcare system in general, but that is probably one of the biggest challenges we're facing, okay? And what that challenge does is that it allows us to pick up our patients really late. Because even those who do get sick, they tend to think it's not COVID, and then they tend to stay at home. And by the time we pick them up and bring them here to give them care, a lot of time is late. Last week, we had 2 people that died before arrival, okay? We had another 2 who died immediately on arrival. What does that tell us? people are presenting much later than they should. Why? Because a lot of times, the disbelief allows them to, stay at home. Okay, maybe it's malaria, maybe it's typhoid. Yes, COVID-19 presents with symptoms that are similar to malaria in the beginning. You have body aches, you have fever, you have headaches, and then you start to, develop cough, respiratory distress, depending on how it proceeds. So this is one of our patient rooms. We have 3 people here. A few of them have been here for a few days now. Okay, and the main thing is just to show you, like there's high demand for oxygen when it comes to COVID-19. All right, we're gonna continue the walkthrough. This is room 4. So we have 2 patients in this room. You can see one of them is requiring oxygen at the moment. The other patient, he's fairly stable, so we're going to transfer him to the other side of the unit. This is Maxwell. Maxwell is one of our physician assistants, very strong man. In this room, we also have 2 patients. So you see, we have several oxygen tanks at the same time. Everybody requiring a very high oxygen flow. Like we said last year, we didn't see these many severe cases, okay? We didn't see these many people requiring oxygen at the same time. We had like 5, 6 severe cases at a time, but now we have 27 today, okay? So that's really important that we stress to people, listen, when you start to have symptoms, and a lot of them are presenting in a way where it's like they feel like they have malaria first, they take malaria medications, they're not getting better, and then, some cough develop. Before they realize it, their saturations, start to drop, all right? So the patient that's in this room, he was one of the most critical patients when he came, all right? So you can see we have 2 oxygen tanks right next to him. He was one of the most critical patients, but now he's pulling through, so we're removing from and brought him up here, in this room. We have a patient now who needs oxygen real quick, so. Patient!
What is that?
Bring the range quick! I think I'll hurry and change that tank quick, yeah? Some of the race there, so the thing is, because of the high demand for oxygen with COVID, it's like nothing we've seen before. People have bacterial pneumonia, people have congestive heart failure, their lungs congested, they need oxygen. But a lot of times in our practice, you give them 2-3 liters of oxygen, they start to improve. With COVID, man, I've never seen before any disease that caused people oxygen saturation to drop to as low as 30%. All right, the normal saturation should be between 90 to 100%, right? Above 90%. That's how much oxygen should be circulating in your blood when you check it with the pulse oximeter. But we see people come in, like the lady who they're resuscitating now, came in with saturation in the 50s. All right, from a local clinic where she was, they were taking care of her, but they couldn't meet up with the oxygen flow. So we have to use these big H tanks. And as soon as the tank is about to finish, that's why monitoring is so important. Because if the PSI in the tanks drop and the oxygen finish, and you're not by that patient bedside to put them on another tank, they become hypoxic again. The saturation drops again, all right? So that's why the guys are running now to grab more tanks. So, up to last week, we had some challenges with, securing oxygen supply. But, thanks to the incident management system, they had a case management, Dr. Brown, the minister, they reached out to people and the Indian community, Sati and Jeti, these people, and it's been a real community effort. They've come together and they've been getting us unlimited supply of oxygen. And Bati, how many of these cylinders do you use on each patient a day?
Okay, based on the patient condition.
So somebody who's critical now?
A critical patient, we use 24 hours, we use up to 10 to 12 liters. Sorry, no. That 24 hours.
Yeah, so it depends on the flow rate. If a patient is on 15 liters, sometimes one patient would mask out this within 3 hours. So every 3 hours, you have to change the H tank. Every 4 hours, you have to change the H tank. Some people 5 hours. So each patient is using 5, 6 of these tanks a day. Sometimes up to 7 tanks a day they will use, all right? So this is Dr. Colley. Colley was the one seeing the patient over there right now. Dr. Colley is probably, he usually stays the longest in the unit, so everybody is afraid of him. When he come in to do rounds, nobody won't come with him. So Dr. Colley, we decided to invite the guys, you know what I mean, just to show the kind of situation. I don't know if you have any, but you may not.
So we just want to welcome you. At least this will create an awareness for people who are doubting that COVID exists in Liberia. Because the thing is that we are seeing more severe cases now coming from the community. Like you were sitting out there, you saw somebody just drove themselves in a car. They have never been tested before. They did their oxygen saturation is 89%. They are very sick. But initially they were afraid to be admitted to the COVID unit, but we have to convince them that look, your saturation is low, so we need to admit you and we'll run your test. So the issue is like that, the community, people are getting sick and they are dying in the community. So thank you for coming. When they see these videos and whatever, we hope that they will really follow the necessary protocols out there to keep themselves safe and their family as well as the community.
I'm Pastor Takadu. I think COVID is real. It's real because my wife got sick and we thought it was just a cold. And then her oxygen level dropped to 55 and went to EWA, and EWA said, should we do the COVID test? And her wife, I said yes. They did it, came out positive, and then EWA couldn't do much on it. It started to 70 and she has serious problem. And we brought her in the ambulance. I said I have to go with her since I've been with her, and I did my test. And then we came here. I tell you, it's real. You can see people in the other rooms and what is happening. The condition in which my wife came, it was terrible. I mean, her whole chest was locked and everything, the coughing, and so forth. Most people don't believe it, but it's real. I'm telling because I'm here. I'm sorry, I'm here with her. They started treating her day and night. The services, they had different crew coming in, checking her in the morning and the evening. And after we see great improvement of breathing level, her improved, the fever, the coughing, the vomiting, everything have gone. It's real. If you come here, you won't believe it. COVID is real. You think it's ordinary thing that you just cough, and you think it's just fever, ordinary. And people say the worst thing, I think if you can see the place is clean, we eat 3 times a day, and the medication is good. So if my wife had not come and we're going to deny it, my wife was going to be gone today, God forbid. So if you are watching, COVID is real. You know, Pastor Tagado, I won't lie to you. This is why I came with her, so I'm a living testimony. It's the plans of the devil to make people not to believe it and to kill our people. But please, pastors, bishops, citizens, let the people know that COVID is real and it's in Liberia.
I'm so excited. I wish I could jump in the air.
She was walking around today.
We need to help more on the outside than on the inside. We need to help more. COVID is real. I came here. I was on my last state. But I tell you, the work I see here, the level of cooperation, the level of excellence, the level of experience, is exceptional. We're trying to list the number of teams, the different groups, and everybody is concerned. And I tell you something, I didn't see anybody creating any situation to extract money from anybody. Like I was delayed to bring you this, and give me something. I did not see it. And I saw everybody making sure that everybody was important. It was not the white man, it was not the black man. Everybody here is important. And we get everything free, clean, and sometimes we get tired with, how you doing? Even the cleaner that comes, you okay? Whatever you say, I tell the doctor, tell this person, God bless Dr. Doe, the rest of the doctors on the ground. I always call the respiratory men, the team men on the ground.
Yeah.
Even the kitchen staff, they're asking, they're carrying food, you all right?
Yeah.
You be strong, you be good. And I'll tell you something, we pass word, I say, God, those who believe, those who don't believe, They come here, nobody must die. Save lives. They need encouragement. It's frustrating to make efforts and people saying what you're doing is a lot. My name is very precious. Jill Daga, do you know me? I'm here. I came here, my son. I didn't know who I was. Nobody helping me. I couldn't do this. He gave me caution and I went along just now. Serious? I couldn't do this. I couldn't talk. You couldn't hear me. I couldn't. Just the first 2 nights I spent here, I couldn't do this. God first. God bless them. God bless our country. Keep praying. But you got a lot of work out there than anybody else. Thank you. God bless you.
So, you know, like she was explaining to you, Chief, was saying the oxygen saturation, it should be between above 90, right? Above 90 and above. When she came in, her saturation was in the 50s on Dr. Doe and then received her. She was on, like you saw the other people, on high flow oxygen with non-rebreather masks for several days. And, you know, at one point they didn't think she was gonna pull through, all right? But eventually with consistent, you know, efforts and management, and she pulled through. Now we have her off oxygen. So she won our success cases that's happening in the last week. And when we told them that you guys were coming today, she was like, I have to talk, you know, because we really, our big concern was always about de-identification and privacy. We don't want people, you know, like labeling people and knowing who's here, but they volunteered that they wanted to speak because of their experience that they had. And so, oh my God, that Adoni, there's the man, my guy.
So, as we close out, we want to tell Dr. Doe and Dr. Jesus, thank you for giving us a true inside COVID treatment center. You guys saw everything that's going on. You know by now how serious coronavirus is in the world, most especially in Liberia because this is where we live. So please, people, this thing is real. It's not a hoax. It's not something that the government is trying to make money off of. People are actually dying. These young men and their staff here are doing their best and their most day in and day out, hours upon hours to make sure everybody gets out of here alive. So, doctors, any last words you want to say to everybody watching?
So firstly, I just want to thank the team for coming here and going through this. Now, I don't know how else we can put it, but COVID is real. And you see me, this is not water, this is sweat. Like, we are making too much of a sacrifice for people out there to still be doubting and playing careless with their own lives. We're doing the best we can. Please help us. Because if you guys don't follow the messages out there, all of this is basically going to be in vain because the cycle is just going to continue. So please, wear your masks, avoid close contact, practice hand hygiene, and when it's available, please get vaccinated.
Yeah, so, well, I think it's a huge thing that you guys came here today. The risk you took, you know, about coming and agreeing to go in the unit with us. I think that's very important, so thank you, man. Thank you, Cypha. Thank you, my brother. Thank you, Stone, for coming. We intentionally really wanted it to be an independent media house so that people don't feel like, you know, it's the Ministry of Health, you know. And before I start, you know, it takes a lot to respond to a pandemic or epidemic. You know, from the incident management system that is headed by the Minister of Health, all the different partners that are on board, these people are meeting day and night, all right? Technical meetings with WHO, USAID, CDC, the National Public Health Institute. All these technical people are sitting down every day trying to figure out how can we control the spread of this thing. You know, if people weren't working, we'd probably be in way worse situations than we are in right now, all right? So now it comes to, I feel like people don't understand what it feels like to be in these PPE several hours a day. Trust me, we don't want to do it, to be very honest with you. Like, I'm tired, you know? And when I was going around telling people, encouraging people to get vaccinated, that was one of the messages I was telling people. I was like, please get vaccinated because I don't want to have to be in a treatment unit. And here we go now, we're in the midst of another surge. Who knows how long this is going to go on for? Maybe another month or two, and maybe it goes down again. But we all have to play our part. People out there in the public have to play their part, you know? especially those that are high risk of getting severe disease. People that are older, you know, people with comorbidities, you need to be extra careful. It's a time for you to be extra careful, you know. Wear your mask, you know. If you can, keep your distance, you know, from people. Avoid huge, large gatherings, at least now. That's the least you can do to help us, you know, get through this thing. And you know, so thank you to you guys for coming. You know, this facility is heavily supported by the government of Liberia and different partners, you know, international and local partners. So we'll let us say thank you to them as well. You see all the care people getting here, right? The oxygen people getting, the medications people getting. Nobody is paying a cent for it. If you spend this amount of time in a regular hospital to get the level of care, ICU care that you get in here, your bill will be in the thousands of dollars, all right? So we have to be grateful to those people for providing us support that we're getting. And to all healthcare workers, man. Like, you know, people come to the unit and the thing is only happening here. No. Every healthcare worker in Liberia now, at every hospital you go to, they are taking people there in respiratory distress. Local clinics, JFK, EAW Hospital, Catholic Hospital, Redemption Hospital. So all those healthcare workers every day are risking their lives to see patients in distress who might have COVID-19, all right? So we have to support our healthcare workers. We have to reduce the burden on our healthcare workers by doing what we need to do so that they can be able to go home to their family, you know, safe, all right? And last thing is just to our boss, Dr. Jerry Brown. He's not here today, unfortunately, but he's the head of case management, and he's the one who, you know, structured this team and got us here today, you know, like working to help people. So a big thank you to him. I guess that's it for me. You know, thank you guys for coming.
If you have not been vaccinated yet, get vaccinated now. If you have any symptoms of COVID or know anybody who has any symptoms of COVID or have come in contact with anybody who has tested positive for COVID-19, please call the hotline 4455.